Is Dr. Ede Edupola Osazua, consultant obstetrician and gynecology at Grachelle Multispecialty Hospital. Today we'll be looking at indication for in vitro fertilization. By way of introduction, the first live birth from in vitro fertilization was reported in 1978 in a woman that has bilateral tubal obstruction. Thereafter, we have had more than 8 million babies being delivered via in vitro fertilization worldwide. The total number of IVF cycles is increasing every year. IVF is associated with some medical risks as well as some adverse perinatal and neonatal outcome compared to spontaneous pregnancy. IVFs are lead to increasing number of embryo being preserved, which we refer to as frozen section, to prevent patients with ovarian hyperstimulation syndrome. Now, there is also increase in number of children carried by a pregnant mother, which is called supernumerary embryos. These are raising some ethical questions. In light of evolution of IVF practices, questions of moral status of human embryos and other ethical issues are of concern. What are the reasons why a woman needs in vitro fertilization? Number one reason is that for a woman that has her tubes blocked, which we refer to as bilateral tubal blockage. Let me say for emphasis, a woman with one tube can conceive and bear a child and carry a pregnancy to term. Secondly, for patients that have endometriosis. Thirdly, for people that have some hormonal issues, for instance, a woman that has polycystic ovary, after all methods of treatment has failed. Thirdly, a woman that has what we call male factor infertility. For instance, men that has absence of sperm, which is known as azoospermia, very low sperm count, or abnormal sperm, which is known as oligospermia. Sometimes too, there are some patients that we cannot explain the reason why they have infertility, which we refer to as unexplained infertility. For women that have an unexplained infertility, haven't tried all, they can benefit from in vitro fertilization. And lastly, for advanced maternal age, it has been found that people don't conceive on time now by virtue of trying to chase or do one or two other things before they produce their children. So for people who are a bit at advanced age, these patients may benefit from in vitro fertilization. There's a patient who has abnormal uterus, or there's a reason why they cannot conceive on their own, this patient can benefit from surrogacy. These are the basic reasons why a patient will benefit from IVF. In summary, reasons for IVF will include tubal blockage, endometriosis, polycystic ovary, male infertility, unexplained infertility, advanced maternal age. So, my name is Dr. Ede Edupola, consultant obstetrician and gynecology, the only doctor of hope. Thank you.